patients and physicians commonly navigate health insurers' pre-authorization requirements, but several insurance reform bills lawmakers heard this week could help. Houston internist Dr. Lisa Ehrlich, San Antonio radiologist Dr. Zeke Silva, and Little Elm internist Dr. John Flores all testified in support of House Bill 3459. The bill would allow physicians to be gold-carded out of prior authorization review for a year if the plan approves enough of that doctor's care in the previous year.
Not only are we working hard to use our staff time to get all these things covered, we're actually seeing patients miss their medications and miss their procedures and not getting things done when they need to get it done. It's a patient safety issue.
We know from patients that they appreciate the transparency, they want to know that the process is taking place, but they especially appreciate timeliness. They especially appreciate care moving forward in an efficient, appropriate manner, and they appreciate that the right procedure, the right study, the right medication is given to them.
The legislation also would require utilization reviews by doctors of the same or similar specialty as the physician prescribing the care.
I just want to start by acknowledging Chairman Bonin.
Dr. Silva also testified in support of House Bill 4012 in the House Insurance Committee.
I'm calling the insurance, so they're taking long to answer.
If health plans require prior authorization, House Bill 4012 would require them to give patients cost estimates for their care and report physicians' network status.
Because if the health plans are going to ask us to provide this detailed information just to achieve authorization, it makes complete sense that that same information could help patients make decisions about their subsequent care.
Saving patients money on prescriptions is the goal of another bill TMA supported. House Bill 2668 would end so-called insurance copay accumulator programs and allow patients to use manufacturers' coupons to buy prescription drugs at a reduced cost. The coupons would apply to their insurance deductible, saving patients money.
Insurance companies have realized how many coupons are used by our patients to pay for these very expensive medicines. In most cases, it's patients that are on diabetic medicines or have other chronic illnesses where the medicines are very high and very expensive. And so this will allow them to get those medicines for very inexpensive amounts.
TMA President Dr. Diana Fite testified for a second consecutive week on one of her top priorities, strengthening the prudent layperson standard in emergency care.
We are in full support of House Bill 2035.
House Bill 2035 would ensure coverage for patients who sought care because they thought they had a medical emergency. It also would require a Texas licensed physician, board certified in emergency medicine, to conduct emergency care utilization reviews.
My doors would be closed.
TMA told lawmakers that covered care delivered by telemedicine should be paid at the same rate as care delivered in person. House Bill 980 would require that of health plans. Committee action on all of the bills in this report is pending. Check out the next Legislative Hotline video or Texas Medicine Today for updates.